Have you ever considered how deeply personal our ideas of a meaningful life or recovery can be, especially when facing serious illness? Sometimes, what constitutes a desired outcome in healthcare is not just about medical facts, but about individual beliefs and values. Value-based futility refers to situations where a medical treatment is deemed futile, not because it is physiologically ineffective, but because it fails to achieve the patient's specific, desired goals or improve their quality of life, as they define it. The core ethical challenge lies in reconciling these deeply held subjective patient values with the medical team's professional judgment and responsibility. The why behind these challenges stems from a fundamental clash of perspectives rooted in the principles of bioethics. Patient autonomy emphasizes the right of individuals to make decisions about their own medical care based on their personal values, even if those values differ from what medical professionals might expect. However, physicians also have a professional obligation to act beneficently, meaning to do good and avoid harm, and not to offer or provide treatments they believe are medically non-beneficial or would inflict undue suffering. This creates a difficult ethical terrain where doctors might feel it is futile to continue a treatment that offers no benefit in the patient's eyes, while the patient or family perceives great value in even a small chance or continued existence. Complicating this further is the potential for moral distress for both patients and healthcare providers. For patients and families, perceiving medical care as futile when they still hold hope or value continued treatment can feel like an abandonment of care. For clinicians, providing interventions they believe offer no meaningful benefit can feel professionally unethical and emotionally draining. This delicate balance requires thoughtful communication and a genuine effort to understand each other's perspectives, focusing on the patient's overall well-being rather than just physiological endpoints. To navigate these complex situations, healthcare teams can employ robust communication strategies. This involves actively listening to understand the patient's and family's goals of care, their definition of quality of life, and what they value most. It is not about telling patients their values are wrong, but about exploring how medical interventions align or diverge from those values. Framing discussions around shared decision-making and clarifying treatment objectives can help. For instance, explaining what a treatment can and cannot realistically achieve, and then aligning that with the patient's priorities for their remaining time can prevent misunderstandings. An insider detail here is the distinction between quantitative futility and qualitative futility. Quantitative futility refers to treatments that have an exceedingly low chance of achieving their physiological objective, often below 1%. Value-based futility, sometimes called qualitative futility, instead focuses on whether the treatment's outcome will be meaningful to the patient. Understanding this difference helps clarify the discussion, moving from purely scientific probabilities to the deeply personal impact of treatment, and emphasizing the importance of ethical deliberation to bridge this gap. Ultimately, recognizing the ethical challenges of value-based futility encourages a more patient-centered approach to care. By fostering open dialogue, respecting diverse values, and employing ethical frameworks, healthcare professionals can work collaboratively with patients and families to make decisions that truly honor the patient's dignity and their individual vision of a life well lived, even in difficult circumstances.